Welcome back to another COVID-19 update, and it gives me great pleasure today to introduce Dr. Orly Avitzur. She's not only the incoming president of the American Academy of Neurology next year, but she's also the editor-in-chief of Brain and Life magazine. And for the neurologists and neurology folks in the audience watching, you've definitely seen Brain and Life. It's basically across every neurology waiting room across the United States, and I'm sure in other places too. So Orly, it's such a pleasure to be here. You know what, just in case, these videos are going to be posted kind of all across different social media streams on YouTube, things like that. Can you tell our viewers what Brain and Life is, and kind of maybe even you're just so involved in all the different publications that the AAN and Neurology Today is putting out there. Maybe you can give a little bit of an overview about how we have doing everything we can to spread the message about neurology.
Right, so it's nice to meet you, and thank you for having me on this video. Brain and Life is a magazine created specifically for neurologic patients and their caregivers, and it's been around since the spring of 2005, and when it was called Neurology Now initially, and over the last few years, April of 2018, we became Brain and Life. And we have a website, brainandlife.org, as well as a print magazine that comes out every 2 months. Great.
That's great. And, you know, the part about Brain and Life that I've liked is it really, I guess, seems to focus on maybe one or a few people per issue, and where people with neurological disorders or people that have really been committed to the cause really get to go deep and talk about their experiences. And I don't know, the stories are just really personal, really touching, and I think it contextualizes a lot what our field is all about. So thanks for doing that.
What we really like at Brain and Life is we tell reader stories and patient stories, and they really give us a clear view of what it's like to be living with neurologic conditions. The cover is usually a celebrity cover. We have some celebrities with neurologic conditions who share their point of view and their experiences, and that's always been something of great interest to the public as well.
Great. So if there's a neurologist watching, or physician assistant, nurse practitioner, or even a member of the public that wants to learn more and maybe even subscribe or get copies of Brain and Life, whether to their home or to their waiting room, what's the best way to do that?
So the best way is to either print up a print issue from a neurologist's office and tear out the insert to subscribe, or go to brainandlife.org. spelled out, brainandlife.org, okay. And you will get directions on how to subscribe there.
Okay, that's great. Thanks so much. So one of the things we wanted to talk about today is kind of talking about COVID-19 from a patient perspective. And what we're doing through the American Academy of Neurology and in collaboration with Neurology Today, we're trying to get out as much information as possible. And we haven't yet focused on, kind of the people that we focus on every day, communicating everything we can about COVID-19 to our patients. And that could mean in an office setting, that could mean in telemedicine. It's now our office setting through virtual offices, and that could also be through website stories in print. Maybe you could give us just your perspective on, how do you suggest and what some best practices about communicating with patients about what COVID-19 is, and maybe what's specific about it for patients with neurological conditions.
Right. When we learned about COVID-19, my initial and immediate impression was that our patients and the public are not going to have a lot of information about this condition and how it affects people with neurologic disease. So we immediately convened the entire Brain and Life Advisory Board. We have 18 members for the English print version, and we have 9 members for the Spanish version. And we held a meeting. We will have our 3rd meeting tomorrow. They're being held weekly. And we talked about that. What are they hearing from patients? What are patient questions? How can we get material to patients quickly to answer those questions and put it on our website in a place where it could be aggregated for readers to hear about? And so if you go to brainandlife.org/COVID-19, you'll find all the resources that we've been working on for the past 3 weeks, and they're continuing to be updated daily.
That's great. That's super helpful. And in our practice, I'm in more of a cognitive neurology sort of practice, some preventative health, and I'm having our telehealth visits, and we're talking about, the usual stuff that we talk about, but invariably every visit comes back to talking about either a friend is sick or maybe a family member, or they have questions. As a neurologist, this is, an infectious disease like this is a little bit outside of our wheelhouse. And now granted, there's new neurologic sequelae, I think, coming out more and more. I can tell you anosmia is something that, we heard about it a week or so ago, and now it's, pretty common. You don't even have to ask about it. Patients are just coming in talking about it. And I'm sure there's other neurological manifestations. But aside from that, from a practicing, neurologist perspective, have you had a lot of questions about COVID-19 in practice? What are some maybe suggestions you may have for a practitioner out there that's, you're supposed to be seeing the person for headache, but they have more questions about COVID-19?
I think that's the actual reality of today's patient. The conversation is invariably going to go to COVID-19. For that purpose explicitly, one of our board members, Tesha Monteith from the University of Miami, wrote about common questions people with migraine may have and how COVID-19 may be an issue for that particular population. Another of my advisory board members, Barbara Geiser from UCLA, wrote about MS and therapeutics in COVID-19. As you know, the disease modulating drugs and DMTs are something that every MS patient is concerned about, and whether it places them in a risk for being somewhat immunocompromised and how treatment can be affected. And she was really specific about which drugs are of greater concern than others, and gave some very practical tips to people living with MS.
That's great. One of the things about COVID-19, I think, when we first started hearing about the disease in January and February, seemed to be a disease that affected, older individuals with medical comorbidities. I think one of the studies I read, the people that got really sick, had 3 or more chronic health conditions, whether it's hypertension or obesity, diabetes, things like that. And if you had those conditions, you were at a higher risk, but the young people, they would be just fine, and kids do totally fine. Well, as data has really come out, we know it's not the case. I think the statistic I saw is almost close to 40% of people hospitalized with COVID-19 are between the ages of 18 and 54. That's not an older person's disease, and most of these, that's a young and middle-aged person's disease. And aside from that, these people, a lot of them were healthy and they were declining so quickly. How do you, from a patient perspective, and whether it's a patient asking you or whether you're trying to educate people through print media or online, how do you balance, not maybe, worrying people, because, in general, I guess the risk of dying from COVID-19 to the general population is low, of course, but it's scary because it can happen to anyone and people can go downhill fast. How do you recommend maybe conveying that message, especially with patients with neurological conditions that predispose them to harm due to the virus?
That is always a question of great concern, even in times before COVID-19, when we discuss topics that are serious, like ALS, or people with serious neurologic conditions such as Alzheimer's or Parkinson's disease or other neurodegenerative diseases. It is a constant tightrope to decide how to present the information without sensationalizing it, without inducing fear. At Brain and Life, we really feel that getting to information makes you empowered. And so we try to do the same thing in the current times. We try to give information as for what we know today about COVID-19 and how it affects neurologic conditions without being frightening. We also like to end with practical advice. So lots of tips from physicians, from experts on how to manage some of the concerns raised in the earlier parts of the story.
That's great. Maybe we can talk a little bit more about your role from Neurology Today. So Neurology Today has literally been just putting out just story after story. Desperate times, desperate measures. I mean, I don't know, 6 months ago, I never would have thought that the Academy of Neurology Today would be putting out videos and it's like every day. The AAN website has a COVID-19 resource page. There was a telemedicine webinar recently that, thousands of people have watched. I mean, we really, a ship, a big naval ship can't turn on a dime and that happens a lot in government and big organizations, but the AAN's been like tremendous. And Neurology Today and Brain and Life, like we're all at a different time. So we've done a tremendous job. But I guess what I would say is, with the fast-paced information, in your role at Neurology Today, I know you've authored at least one story. What have you been involved with Neurology Today with spreading the message?
So I've been writing for Neurology Today since 2001, so with the same editor. So it's been very easy to write, continue to write and turn my writing into COVID-19 topics. I think I've now written about 6 stories on COVID-19 in the last few weeks. What's unique about the Academy and what's actually quite remarkable is we are arguably the only professional medical society that has so many publications. We have a patient-facing publication, we have a member-facing publication, both of which have their own infrastructure. They have editors in place, writers in place, physician advisory boards to help with content and ideas, and other publications as well. All of our publications have met regularly and are geared up to address COVID-19. Neurology, the journal, is doing great work under Jose Marino's editor, is the editor-in-chief. And as you know, Neurology Today is also working extremely fast to get good content in and to get it all reviewed and published as soon as possible. And it's a unique position to be in, but we are incredibly lucky to already have the infrastructure to get information out so quickly.
That's great. Well, Dr. Avitzur, I really appreciate your time. Super helpful. I hope that our viewers learned a lot and will be able to get additional resources. Maybe I'll end on just a little bit of a different note. 1 year from now, in a few days, I'm not sure when the San Francisco meeting is, you're going to be taking the helm of the AAN. Maybe just briefly, what are you most excited about for your role as the incoming president of the American Academy of Neurology?
I have always loved the American Academy of Neurology, and I am so excited to be president-elect. I think that these are going to be very challenging times, and the next few months are going to be very difficult for many of our members, and we are going to do everything we can, as we already are doing, to help our members get through this time and to be supportive to them and to advocate on their behalf and to try to get everyone back up on their feet and seeing patients and doing what they love and do so well. And so I'm excited to be there and to help make that happen.
That's great. Well, it's been a tough road for a lot of us, whether we're in practice and changing everything, small practices, large practices, academia, industry, whatever it is, everyone's suffering between money coming in and volunteering, being out of our comfort zone, being redeployed, residents, students, fellows, practicing physicians, PAs, NPs, nurse, everything. The list goes on and on. So I appreciate that message. It's nice to end on a hopeful note. It's going to be a tough couple of weeks, months, year, but 2021 will be an exciting time. So Orly, thanks so much for joining us today, and we really appreciate it.
Thank you so much.
Cool. And if anyone's watching, if you have topics that you'd like to hear about, just shoot us a message. We're at elearning@aan.com, and we'll try to share the message and interview people that you may suggest. Thanks so much.